Webcast coverage of the Minnesota House of Representatives is brought to you as a public service by House Public Information Services.
Oftentimes, we can sometimes lose sight of what's going on outside of our walls, and really our purpose here today is not to have legislators speak except briefly here, but to show that there's a lot of work and a lot of interest outside the walls of the Capitol, and that's what's really driving healthcare reform. There's interest among labor and business, among healthcare professionals of all stripes, about doing something about a broken healthcare system and making it better in Minnesota. And that's what our common goal, I think, is here, is to make sure that Minnesota's healthcare system is affordable and accessible and quality and comprehensive, and that all Minnesotans have access to that kind of healthcare. And so with that, I'd like to, we're going to have 4 folks speak today, representing kind of a number of different perspectives. Tom Forsyth of General Mills is here today to share some of his thoughts. Dr. Maureen Reed, who's a physician and former medical director for Health Partners, is going to share some of her thoughts. Jan Malcolm of the Courage Center and a former commissioner of health is going to share some of her thoughts, and then Elliot Seid from AFSCME will be speaking as well. So I'd just like to turn the microphone over to them to share their perspective on where we are in healthcare in Minnesota.
Good morning, everyone. My name is Tom Forsyth. I'm actually the VP of Corporate Communications at General Mills, which means I really shouldn't be here. Sean, you heard this line before. But I'm also the health policy guy, and I have been for 17 years. I've been working on this topic for 20 plus. And the one thing I can tell you is that this is hard work. It's always difficult. I've been at this for a very long time, including serving on the Minnesota Healthcare Commission. And I've had the privilege the past year of serving on the Healthcare Transformation Task Force. And I think we delivered a very good plan. I also think that the time is now. That now is the time for us to take the first step, the next step towards healthcare reform, and what we would say is healthcare transformation. I think the most important part of that is payment reform. Right now, when I've been talking about this topic, I have been asking 4 questions and asking for the reaction of the audience based on a show of hands. And the first question I asked is, how many of you are paying more for health care than you were last year? Now, that's a bit of a layup, because, in fact, everyone is paying more for health care than they were last year. So I get 100% show of hands. Then I ask the second question, how many of you are paying substantially more than you did for health care 3 or 4 or 5 years ago? And that's another layup, because we're all paying substantially more for health care than we were 3 or 4 or 5 years ago. Then I ask what I think is the key question. How many of you are concerned about the cost of health care? How many of you are concerned about your own insurance, whether or not you'll still have it, whether or not you can still afford it? And you'd be surprised, I think, that I get almost the same number of hands every time. And my fourth question when I give this talk is I say, how many of you think we should do something about this? And again, I get nearly 100% of the audience agreeing that we should do something, and we should do something now. So when my friend Tom Huntley asked me to appear, I said, well, what should I say? He said, make the case for urgency. And I'm happy to do that, because I think we should take the next step, and I think we should do it now.
Good morning, ladies and gentlemen. I'm Maureen Reed. I'm a physician, as was mentioned earlier by Representative Thissen, and I have been in healthcare for more than 25 years here in this Twin Cities community. And in 25 years, I can tell you, I am more optimistic now that a fix for our healthcare woes is within sight than I have ever been in the previous 25 years in my career. And why do I say that? Why do I think that now is the time? I can only think of 2 reasons: people and business. On the one hand, people. People are worried that they won't be able to get the care they need, or if they get the care they need, they won't be able to afford it. And our neighbors in Roseau and Redwood Falls and Roseville and elsewhere all have the same concerns. We can do something about that. We can fix that for them. On the other hand, business. Business has only one concern: economic viability. You know what? We can fix that too with comprehensive health care reform. There is no bigger economic stimulus package that Minnesota could deliver to itself than a comprehensive health care reform plan that cuts health care costs by 20%. That can't be even envisioned in other states. We can deliver that for the businesses of Minnesota, and we should. Now, will it be easy? Not on a bet. And it won't be easy, not because it is technically difficult. It's politically and humanly difficult. But it is entirely doable, and it is completely necessary. So with health care for our patients, for our neighbors, for our citizens, for our businesses, we really need to deliver a comprehensive health care reform package that is not only within our sights, it is within our grasp. So I say, let's get on with it. Let's just do it. 2008 is the year. Don't wait. Do it now. Thank you.
Good morning. I'm Jan Malcolm, Chief Executive Officer at the Courage Center, and rarely do I follow somebody more optimistic than me. So, Maureen, thank you. My staff are laughing at that. It is a great privilege to be a part of this community and part of the people in this community that are so committed to making a healthcare system that works for all of us. I want to just add a couple of thoughts to what's already been laid out. I, too, think the time is now, and the time is now for a very comprehensive approach to this problem. This is the best shot we've had in probably 20 years to do something comprehensive enough to avoid just simply shifting the problem, shifting costs from one payer to another. More and more likely these days that ultimate payer is the consumer, of course. Most of what we do when we tinker around the edges is simply to shift the cost to someone else or to the future, and we can afford neither one of those things. Of course, there are a lot of complex issues and things in this bill. There's something in this bill for everybody to love and something in this bill to make everybody very, very nervous. And I think that's as it should be when you are trying to change something that touches as many parts of our community as comprehensive health reform would need to do. I, however, believe that with the right people at the table, with a commitment to build a better system, not for any one of our individual interests alone, but for the community as a whole, we have got the right experience and the right smarts and the right community motivation in this city, in this state, to do the right thing. I've had the privilege of working some at the national level, and folks always say, well, you have such great tools in Minnesota. You have a nonprofit healthcare system. You have a civic culture. We have not seen this kind of leadership in healthcare for many, many years, and I think we owe the task force, the legislature, the governor, and all these stakeholders a real compliment and a real vote of thanks for the hard work they've already done and the even harder work yet to come. Of course, every detail is not going to be perfect in the bill. I don't think it needs to. If we're careful about having the right people at the table as we design the implementation, I firmly believe we can work out the issues that are causing people to raise questions about exactly how this would work or that would work. But if it's not comprehensive, if we don't go after the truly hard-to-fix things, we will not make a substantive difference for the long term. On the question of urgency and the budget deficit, and I think we were all perhaps not surprised but sobered by the economic challenge the state faces, I think that adds urgency to healthcare reform. That is not a reason to delay. As the governor and legislative leadership rightly pointed out, it is healthcare that is driving a lot of our economic challenges in the state. It's hardly going to be any easier if we wait for another year or another biennium to fix this problem. This is a matter of helping to address the state's structural budget challenges. And finally, in terms of the people that we serve at Courage Center and the folks in the community who struggle with some of the most costly, the most complex kinds of conditions, it's those folks who can't wait for healthcare reform. It is their health and independence that is being compromised by the backwards incentives in today's system. Not just the people without coverage, the people with coverage in a system that is not working maximally to protect and improve and maintain their health and independence. So I appreciate all the effort that's going into this very important topic this year. And along with my colleagues here, I urge all of us who have a stake in this issue, which is all of us, to roll up our sleeves, stay at the table, and get this done. Thank you.